Welcome to this session of Analyse and Respond to Client Health Information. Analysing client health is performed through gathering objective and subjective health data, and this is done through a series of steps to ascertain interventions required to support or improve client health status. Also to assess the impact of the interventions on the client health status. The first step is to obtain client health information, and this can be collected from a variety of sources, and we'll discuss that. Obtaining client health information is an important part of nursing care. It gives us an indication of the client's physiological state and their well-being. It assists us in directing care for that person, allows progress to be monitored, and ensures prompt detection of adverse events that may delay recovery. So we're looking at variations from normal. So it's not just about vital signs, it's gathering information from a variety of sources. And we're able to measure outcomes of the healthcare that is being delivered. The client interview is one way of gathering their health history, looking at their chief complaint, any signs and symptoms that they may be experiencing with that chief complaint, a previous health history, because that may impact on, why they've come into hospital, the family history, if there's been any. It's important also to collect information from significant others, so family, friends that have come in with the patient. So a parent may give information about a child that's unable to verbalise and support information if the child can. If the person's unconscious, the person can't verbalise because of a health alteration, like they have pain or they're short of breath and they can't speak. Family and significant others have a handover is one way that we can gather data from the nurse that's been looking after the patient for the shift to the nurse that's going to be looking after the patient for the next shift. So we look at the overall health status in that handover, any changes in the health status, any improvements or deterioration. And it's important to note that we don't solely rely on this information because it's verbal and some things can get missed. It's good actually to have a process where you go through body systems, through the handover, and talk about each of those body systems and what health alterations are occurring. It's a good way to trigger collecting as much information. The admission and discharge documentation gives us a broad overview of the health status on admission. So we're collecting information that's also subjective, and we look at the information in that admission and discharge documentation in relationship to the complaint that they've come in with, if there are any internal or external factors that may be affecting their health. Do they utilise any health services at the time? Because that can give us an indication if they have any self-care deficits. And also we need to be thinking about reinstating those services on discharge. Nursing assessments are a way in which we gather objective data of the client's health status. We might do this through temperature, pulse, respirations, blood pressures, blood glucose level, neurological examinations. Physical assessments also important, where we, through a process of inspection, palpation, auscultation or percussion. So inspection, we may be looking at their skin colour, the wound, is it infected, is it healing? Palpation, we're seeing if there's pain in certain areas of the body. With auscultation, we're listening to lung and heart sounds, and percussion, which is not commonly used in nursing, can assess fluid in a space. So, if someone's got pneumonia and they've got fluid on the lungs, it can be assessed. Through observation, we can look at their psychological demeanour. Are they agitated? Are they aggressive? Do they have a flat affect, not communicating? What are their behaviours like? Are they inappropriate? What's their communication like? Verbal and non-verbal body language. It's all important part in our assessment process. Healthcare has a multidisciplinary team approach, and care provided is a team approach. So we gather information from all the team members, and that provides valuable data as to where to move forward with the client's interventions. So, there may be specialised interventions like from the physiotherapist, the occupational therapist, the dietitian that can direct our nursing care. So we need to follow. The medical examination is performed by the medical officer, and that's quite detailed on admission. We can gather information from that to add to our nursing assessments. It's required with identifications of variations from normal or variations from their admission status. So if you notice anything different, the patient will require a review from the medical officer. And it's an important role in nursing to communicate these findings with the medical team. Diagnostic testing that may have been completed prior to admission is important in assessing the health status. They may have had the diagnostic testing done during their admission. So there's blood tests, ECGs, X-rays, ultrasounds, a variety of different types of diagnostic testing that can assist with identifying variations from normal. So identifying those variations from normal parameters enables the nurse to plan interventions. So a chest x-ray might show that the person has pneumonia and the doctor orders antibiotics. So as a nurse, that is your role, administer those antibiotics and monitor the outcomes. A low potassium on a blood test, we will give a potassium replacement, and we need to follow that up to make sure the potassium parameters are returned back to normal. A bladder scan may be performed if a person can't. Now that you've collected all the information from a variety of sources, you will be required to draw on your knowledge to assess all of the information. So drawing on your knowledge that you've learnt throughout the course, bringing it all together to be able to assess and analyse a client's health status. So you can use your anatomy and physiology, pathophysiological processes, common disorders of body systems, knowledge of what's normal and what's not, what are the variations and deviations from normal. Another important factor in assessing and analysing the data is to make sure that everything that you gathered is documented appropriately. All of the health team can actually review current with past observations. You need to report any variations from the baseline as they occur, so not at the end of your shift. As a nurse, you are required to know what to do with the health data that you've gathered and you've assessed and analysed. So look at documentation, policy and procedural. And this brings us to care planning. What nursing interventions are required? So are you going to do vital signs more often? Some people will have them daily, some will have them twice a day, others will have, every 2 hours. So you need to analyse the data in order to come to a decision about, how often you are going to assess your client. Monitoring the fluid balance chart. are there any changes in wound care? So in any intervention that we perform, we need to identify the expected outcomes. So I'm going to dress this wound every day. I need to see that it's healing. We document that on the wound chart. So the expected outcome is, these products that we're using on this wound. In providing care, we need to make sure that we follow the policy and procedural guidelines of the organisation that you are in as a student or that you end up working for. Make sure that you are working within your scope of practice. And it's your responsibility as a nurse to know what is within your scope of practice, because it'll be different for every organisation that you work in. Some organisations provide training in certain areas. That means the nurse is able to perform those activities because the organisation has supported it. So in following policy and procedural guidelines of the organisation, it might be through documentation processes such as care plans, ob charts, progress notes. A lot of organisations Australia-wide have track and trigger obs charts, and they've got colour-coded levels, and if the observations of the client fall inside those colour parameters, it gives you an indication of the intervention that you need to employ. Variations from normal indicate that something is happening within the body's vital organs. So it's very important that they have a medical assessment to ascertain what's actually going on. And then care can be changed or modified to An important part of your nursing practice as a student and an enrolled nurse is identifying limitations of your role. One way that you can ascertain if you're able to perform an activity is to look at the ANMAC Decision Making Framework. This is a tool that's been developed to assist in identifying for all nurses whether they are working within their scope of practice or not. So the tool has a series of steps, so questions that you ask, and that will identify. It is very important if you undertake any nursing activity to ensure that you follow the steps in the ANMAC Decision Making Framework, and you can review the framework from the link provided on this page. So the first question that you ask yourself is this task within your scope of practice as an EN? So have you had the training, and have you been deemed competent in that activity? The next question you ask yourself is it within the organisation's policy and procedural guidelines for you to do the activity? So you need to check the policy and procedural guidelines of the specific task. A lot of hospitals will have every task that a nurse does written up in a procedural guideline, and it will say at the start who can perform this task. Even if you've had the training and been deemed competent, the organisation may not allow you to perform the activity. So that's why it's important to check those guidelines. Also ask the nurse in charge, but I would be checking the procedural guidelines in the first instance. And they're easily. The other point is a risk assessment. So looking at the legislation. Does the legislation allow you to perform that activity? The complexity of the task. Is the task too complex for you? You may have been taught how to do a simple wound, in your class, and then you get out on placement and the wound's infected and it's large and it requires packing. You might not have been taught the skills to actually deal with the complexity of a wound. You might want to watch the RN perform the task, so then you can get some knowledge of how to perform it next time. Do you have the knowledge and the skill level to perform that task? They're very important questions. The fourth question that you need to be asking is, do you have the competence, the confidence, and the accountability to perform the activity? So even if you've had the training, as I mentioned before, are you confident to be independent in the task? So the key word is independent. You may have not done the procedure for a few years. You may have, done it in your training and then not again until, a few years later. So in that instance, it's, best to revise the task, watch somebody else do it, get somebody to watch you doing it. So if there is a no to any of these questions, the EN must consult with the RN. They may be able to complete the task under supervision or the responsibility. So this brings us to the end of the discussion for Analyse and respond to client health information. For this activity, you are to choose a multidisciplinary healthcare team member from this PowerPoint or one of your choice and discuss in 100 words their role in contributing to gathering client